Across Asia, a black market in the illegal sale of body parts is flourishing. This organ trade benefits the rich patients and exploits the poor. But Singapore is considering a controversial measure that could eliminate this black market while improving the lives of kidney patients. I'm Fauzia Ibrahim. In this edition of 101 East, we look at the cost of legalizing kidney sales. Singapore has the 5th highest number of kidney failures in the world. Some 1,000 new cases are diagnosed every year. With patients waiting up to 10 years for a suitable donor, some are travelling overseas for transplants. But a controversial government plan could just bring new hope to those suffering from kidney disease.
They told me I have kidney failure when I was 31. I have to go for dialysis 3 times a week, about 4 to 4.5 hours. I was going in and out of hospital quite often as well.
For Roy Lee, the daily ritual of treating his kidney problems has been replaced by one much more to his liking. But 2 years ago, he could do little more than sit and wait as the search for a suitable donor within Singapore continued.
During dialysis, I can't really do any sports at all. I'm just too tired to do that. And I go through a lot of operations. And dialysis is not cheap at all. So the better way is that, just go for the transplant and, really solve the problem.
Roy had heard of a private hospital in South China specializing in kidney transplants. Driven to desperation, he pushed aside personal fears and paid $40,000 for the surgery. He didn't even know whose kidney he was receiving.
It didn't come to my mind to ask, honestly. But, from what I heard is either executed convicts or people who are willing to sell their kidney. The doctor I went was actually the head doctors in the hospital. He took care of most of the foreign patients. And even after I came back, he still communicated with me to check on my condition as well.
It's not known how many Singaporeans undergo overseas transplants every year. Organ donations here are few and limited to among family members. Some kidney patients have had to wait up to 10 years for a suitable donor. Faced with rising kidney cases, the government is looking at ways to boost the number of organ donations. Among them is to legalise the sale of kidneys. For some, this isn't as controversial as it seems.
I think we should actually right now look at compensation for donors. And what people must understand is that a lot of these people, after the donation, there would be a period of recovery. They have to stay off from work. Some of them would develop hypertension. So the recommendation, at least by the international community, is that they should be followed up for the rest of their life. So the question is, who has to pay for this?
The World Health Organization estimates that at least 10% of transplants around the world involve organ trading. One argument for legalizing kidney sales is that it would offer protection to both the donor and the recipient. But does that mean an end to black market trading?
I don't think there will be a perfect system. At the end of the day, there will be people who will die from kidney failure because they are not getting transplants.
Others say legalizing kidney sales would affect the social ideal of altruism.
We can no longer call it donation. If we go that way, we are making human organ and human body materialistic and dignified. Whether or not this will spill over to other kinds of donation, blood and bone marrow, and then as a result, it's changing the nature of all kinds of human relationship in terms of helping each other.
Given the ethical and pragmatic issues involved, the debate over legalizing kidney sales will be long and heated. But until a solution is found, Singaporeans like Roy will continue to look overseas for medical help. For more on the legalization of kidney sales, we're joined by Professor Jeremy Chapman, President of the Transplantation Society, Dr. Akira Wu, who is a consultant nephrologist at Mount Elizabeth Medical Center in Singapore, and Dr. Sankaran Sundar, Chief Nephrologist at Columbia Asia Group of Hospitals in India. Gentlemen, thank you very much for joining me today. Dr. Wu, if I can just start with you, why is there a shortage of donor organs in Singapore?
I think Singapore has been relying on mainly deceased donor kidney transplants and also living related. partly because of good traffic management and also improved industrial safety. The number of deceased donors have been dropping in Singapore, and lately we have been more dependent on living-related donors. I think those are the reasons why the deceased donor numbers have come down over the years.
Jeremy, is there a global shortage of kidney donations?
Transplantation is so successful that there is a shortage of kidneys, of hearts, of livers, pancreases, lungs. There is a shortage. What does that mean? It means that we are able to transplant successfully so many more patients than we have donations. So there will always be a shortage because we're getting better and better at doing this. So what we have to manage is to ensure that we can maximize the availability of transplantation for the patients in need. And that is true all the world over.
And how do you maximize the supply, shall we say?
Well, a number of countries have shown us that. So United States, Spain, Belgium, Austria, Norway. Some of them have done it through increasing living donation and deceased donation. Some have done it through just increasing deceased donation. It requires organization, structure, law, and process. And it requires the understanding of the communities.
But the black market in illegal sales of body parts is flourishing, and the WHO has listed India as being one of the main suppliers for trafficked organs. In your experience, Sundar, why would someone want to sell their kidney?
I've been in the transplant field for the last 26 years, and prior to 1995, we had no law for or against sale of organs, and we would have donors coming up and offering to sell kidneys. Many times it is the donors have some personal reason. They have a child who needs a medical care, which the government or the community is not offering, and the medical care would cost money. So the father would say, why not I donate a kidney, get money and treat my child? So many times that way, many times it's greed. But the basic thing is desperation, poverty, desperation on both sides. You have a dying patient with no related donor, and you have a poor man with nothing to live on. So that's the question. And the problem comes when the middlemen exploit this desperation. So that's why we have to look at something out of the box, something different.
That is the main controversy about this particular issue, the legalization of kidney sales. Jeremy, if there is a worldwide demand, and if Sundar says there is a supply, why not let that demand and supply come together? Why not allow the legalization?
It's a nice myth, isn't it? And it's perpetrated by the middlemen, not by my friend Sundar, who I respect greatly. The middlemen take the money, they pillage the poor, and they put in jeopardy every recipient. So there are studies both in India and in Pakistan which have gone back to those villages who have hundreds of people whose kidneys have been ripped from them. And they've asked questions. Did you get the money you were promised? No. Are you out of poverty that you intended to get out of? No. Are you in better health than before? No. Can you still earn money? No, because I'm now in worse health. So the middlemen have got bigger airplanes, more engines on their plane, richer people. The patients have been put at risk by unassessed donors. The donors have been put at risk and jeopardized, and their position put in a myth.
But we are talking about the black market, though. What about here in Singapore, where they're proposing a centralized body regulate the sales of kidneys between donor and recipient? You're offering protection, you're basically cutting out the middleman. Would you be in support of that system?
Singapore signed up to the Human Rights Charter for the United Nations. Singapore is on the executive board. The statements from the Minister of Health in Parliament, none of them have suggested what you're suggesting. I think it's highly appropriate for Singapore, this vibrant marketplace, to open up the conversation, to consider why the market is an inappropriate solution for this problem. Singapore solves many things through the market, but it solves many things outside of the market, and this is the one to solve outside the market.
Dr. Wu, would you agree that this sort of system will not work in Singapore? Or should not work in Singapore?
No, I'm more in favor of, like Jeremy said, a more regulated system. I think what we're thinking of doing here is to have a system that will make sure the donor either be living related or non-related would be reimbursed for the medical cost of the operation, time lost from work, some loss in the quality of life, and perhaps long-term health insurance to look after the donors. So the system I think we're talking about is not a direct deal between the recipient and the donor. So the donors would typically donate into the pool of kidneys, and the kidneys will be distributed out based on the current kidney transplant criteria that we have. So there will be arm's length between the recipients and the donor.
We'll come back, and I want to take you up on the altruistic issue, but we're going to have to go for a break here. But when we come back, we'll hear from a kidney patient who's been waiting 4 years for a donor organ.